and can be on camera, I'd be delighted just for you to say a couple of words.
All right. Well, thank you, Hope. I'm supposed to be unmuted. Can you hear me?
Well, unmuted.
Okay. I didn't want to talk to myself for 10 seconds. As Hope said, I'm Jeff Stoddard with Truist, which was, most of you know, the merger between BB&T and SunTrust. And we've been very excited and proud to work with NCICU for years, and the Ethics Bowl as long as it's been going on. And to us, this is such an important thing for us to learn how to communicate. So don't make the mistake that this is about hard decisions and hard topics, because those will always be with us. But we are slightly losing our ability to communicate professionally in non-threatening manners with each other. And this opportunity here is just a wonderful exercise in how to do that. So again, we are very proud to be part of it. Thank you for letting us be part of it, and Hope, I'll turn it back over to you.
Thanks so much, Jeff. We appreciate all of your work with the advisory board, and also, of course, this great sponsorship. Our benefactor this year for our sponsorship comes from Sarah West and Tom Dominic. And I will ask you to be sure, if you didn't get a chance to read about Cam West, Sarah West's father, and also the father of Tom West, our Vice President for Government Relations and General Counsel, there is a part of our program that is a tribute to him. He was one of the first presidents of NCICU, also president of Pfeiffer University, and many other roles that you'll be able to read about. But we appreciate so much, Sarah and Tom, that sponsorship. We have a number of associate sponsors. Duke Energy, I think we have Tammy Thurman here, and they are a legacy donor, as in from the very first Ethics Bowl year. Macmillan Pasden Smith with Karen Calhoun, Mount Olive Pickle Company, which is one of our team sponsors again this year. TIAA, we're delighted to have Liz Morris and Molly McCormick here on behalf of TIAA, and appreciate their sponsorship. The Wren Foundation with Margaret of St. Alban, who's vice chair of our advisory board and also a team sponsor. Our friends are important to us as sponsors, and Ads Infinitum, we appreciate that support. Cherry Beckert, we have Matthew Soka and Roselle Benoit who are with us. Coca-Cola Consolidated, Thomas Vanador, Court, we have Vanita Danowitz, Elevate Textiles, Dolores Sides, a former chair of our advisory board and is a legacy donor. First American, Phil Palermo. Southern Bank and Trust, Drew Covert. Melanie Chris Thorpe, Colleen Kinzer, Steve and Liz Riley, and I think Liz is with us, and Patricia Yancey. So thanks to all of our sponsors. I hope all of you will join me in giving them a virtual applause here to thank them for their great support. It is now my great pleasure to introduce our keynote speaker today. Our keynote speaker is Mike Sprayberry. He is the Executive Director and the Deputy Homeland Security Advisor for North Carolina in the Office of the North Carolina Emergency Management NC Office of Recovery and Resiliency. Mike was appointed Director of Emergency Management in 2013, and he now also does serve as the Director of the Office of Recovery and Resiliency. Who knew that we would need such an office, right? But we do, and we're so glad he's there to manage that. As such, he does manage the state's preparation for, response to, recovery from, and mitigation of both natural and human-created disasters. He also serves as the state's Deputy Homeland Security Advisor and a member of the State Emergency Response Commission. Mike began his emergency management career in 2005 as the Deputy Director and Logistics Chief. He has also served as the President of the National Emergency Management Association and as a member of the FEMA National Advisory Council. Prior to joining state government, he served in the U.S. Marine Corps and the North Carolina Army National Guard. I have to say, on a personal note, that when the pandemic first started and all of our colleges were figuring out in March about having to go remote, and the governor was issuing the first stay-at-home order, Mike and I stayed in close contact because we were trying to get information out to our colleges and universities. And I have to thank him. I know he was receiving thousands and thousands of emails and texts. He was always responsive. And that is a true indication of a leader who understands the challenges that those of us on the ground are having, trying to help our, in this case, colleges and universities understand what was happening. And so I'm delighted that he's with us. I'm especially delighted that Mike made time for this today, because he will be, after he speaks to us, he will be on his way for his second dose of the vaccine. But he fit us into his schedule. And Mike, we're delighted that you're going to be getting that. But we're especially pleased too that you found time to be with us. So Mike Sprayberry.
Well, thank you, President Williams. And I got to tell you that a couple of bonus things for me today is that I have is the opportunity to get to see you live, even if it's not in person. And I can tell everybody on here that the president runs a tight ship, and she is a heck of an advocate for all of you. And so just let me say that up front. The other thing that I would say to everybody is that, you know, when you go to an event, you always, I always look for nuggets that I can take away to use for myself. And what Jeff just said about non-threatening communications, I'm going to take that. That's good. I think I can use that in some of my interactions that I have with some of my teammates. Before I get started, I'll just tell y'all that, it's been a busy week for emergency management. We started out with a horrible tornado down in Brunswick County where we had fatalities and critically injured people. We strapped in for a winter storm that ended up underperforming, which we're blessed for that. And so they were predicting, our Duke partners were predicting up to 1 million folks without power. So we missed that one. So been a busy time underneath all of the actions with the pandemic. And so I did want to talk to y'all about how we consider ethics during a pandemic. So thank you for allowing me to be here, President Williams, and it's a real privilege to be at the 10th annual Ethics Bowl, because when you say something that's been going on for 10 years, that means there's a continuity of operations. That means that there is a dedication to making things happen year over year. And that just doesn't happen by accident. That means there's commitment. And so hats off to y'all. So today is day 348 of the activation of the State Emergency Operations Center for the COVID response. It's the longest activation in the history of North Carolina emergency management. In a little over 2 weeks, we'll hit the 1 year mark, something none of us ever anticipated when we first went into a unified command structure with the North Carolina Department of Health and Human Services. For those of you unfamiliar what a unified command is, it essentially means that emergency management shares the lead and the management of this crisis with our partners over at DHHS. Secretary Mandy Cohen and her staff serve as the technical lead, while at emergency management, we work to provide the wraparound services. And so they provide those health components, which are vast. What I can tell you is that ethical concerns surrounding our response to the COVID pandemic has been a topic of discussion since the very beginning when we activated. If you have to face an unknown disease with a certainty that it would spread throughout the state, where would you begin? Confirmation of the first COVID cases in the state came in an early part in March 2020, prompting the governor to declare a state of emergency on March the 10th. The governor's executive order 116 made the declaration and laid out the framework on how to deal with the pandemic, and a national state of emergency came a few days later. Like I said, we activated on the 10th. The last day I've been in a restaurant is on March the 9th. Just wanted to tell you guys that. One of the first actions we took was to establish a public health incident management team. Experience with other health crises and training exercises helped to inform us on what we need to do early on, such as preparing for mass testing and providing access to healthcare services regardless of a patient's ability to bear the cost. Listen to that, regardless of a patient's ability to bear the cost. So when you think about what we're doing and how we're responding, you're automatically, we have to consider people that are less fortunate than probably most of the people that are on this WebEx, right? What is the right thing to do to make sure that all of the people in the state are being cared for? Many of the folks in the state don't have adequate health insurance, and in some cases, they don't have any at all. You probably know somebody in that case. Their financial situation may be one that limits their access to preventive health care, which puts them at a greater risk of getting sick. Keeping this in mind, we knew it was important for testing to be free for everybody, and sites had to be strategically located throughout the state so that everyone who needs to be tested can be tested regardless of their socioeconomic background. Working with our health and human services partners, we also recognize that COVID posed a particular threat to our first responders and healthcare professionals, which meant we needed to ensure they had the necessary PPE, personal protective equipment. While the state warehouses had some PPE, we knew the response to this crisis required a lot more. Additionally, the federal stockpile was very limited. We found that out during this crisis, and it put the entire nation and really the world into a scramble to source and purchase PPE. Our logistics team had a monumental task in the beginning of the pandemic when faced in getting PPE to the state. To their credit, they scoured the market and brought in necessary gloves, masks, and other needed equipment. The challenge became prioritizing where the PPE needed to go. So it was clear that non-congregate care facilities, such as nursing homes, were being impacted particularly hard, as those over the age of 65 are particularly susceptible to this disease, but also its lethal possibility. We knew we had to get PPE out to the healthcare workers and the staff at those facilities as quickly as possible, while also filling the needs of the hospitals and the other healthcare facilities of the state. So that's exactly what we did. I'm proud to say that, basically I don't have a huge purchasing and contracting team, but what I had to do as the CERT leader was to look around my team and figure out who were the people that I could put on the sourcing team and to interact with private sector to find the right types of PPE. And let me tell you, there's a lot of folks out there that are selling stuff that's not exactly what they're saying that it is. And, but they did a great job, and we didn't get any counterfeits because we don't pay up front, and we have industrial hygienists taking a look at everything that we receive in the warehouse. So we set up a system that when the supplies came in, we do what we call pivot and push. We receive them, make sure they're what we ordered, and then we pushed them out the door to the people that needed them. That work continues today, although the pace has slowed a little bit as PPE has become more available. Let me say to y'all, I have a meeting with DHHS every morning at 8:15, every morning. Every morning, I meet with the governor at 10 o'clock. Every afternoon, I meet again with DHHS at 4:30 for an hour to an hour and a half. If you don't think that this pandemic is the number one priority for the governor and his whole team, I'm just telling you, let me emphasize that. I get it's amazing, all of the work, and it should be that way, right? This is our major threat. While we're addressing the need of our medical community, it also became clear that residents were going to need assistance with getting the medical care that they needed. So the governor petitioned the federal government to waive certain requirements of the Medicaid program to help pay for care that may extend longer than usual during the crisis and reduce the burden on Medicaid and North Carolina health choice providers such as doctors and hospitals, as well as beneficiaries. This included doing away with rule limiting on how long Medicaid will pay for a patient admitted to a hospital. The waivers also cut red tape so that they could relax limitations on Medicaid payments for home and community-based services so high-risk patients can get the needed treatment at home instead of exposing vulnerable patients in high traffic healthcare settings. That's really critical. Finally, we temporarily waived the required annual enrollment fee, co-payments, and unpaid enrollment fee balances, and we waived the prior authorization requirements for children's health insurance program so we could lift barriers on child health care. That's critical. In addition to reducing barriers to health care, we need to reduce the number of people congregated in public spaces to slow the spread. You've all heard this, you've all tracked this. That began with limiting mass gatherings to less than 100 people, including auditoriums, stadiums, arenas, theaters, fairs, parades, festivals, schools, everything. No longer could you attend a concert. I love concerts. No longer could you go to the movies, go to a club, or anything else. After additional guidance from the federal government, restaurants were limited to carry out, drive-through, and delivery only, with indoor seating prohibited, and gatherings were limited to less than 50 people and then less than 10. I can tell you, I mean, I got to sit and see how these decisions were made. And you continue to receive guidance from CDC, from Operation Warp Speed, from the White House, from all these various sources, and they all come into the state, and then discussions have to be held so that we determine what are the policies going to be for our state. And it's really amazing to watch all these smart people working on making these really difficult decisions, because you all know that every decision that's made, not everybody's going to be happy. But I think that the governor makes these decisions. The ultimate goal is making people as safe as possible, but it's tough. Think about the implications of these actions. How do you balance the need to keep commerce and the economy moving without jeopardizing folks' health? Unfortunately, it's difficult to reconcile both, but we were able to find some solutions to provide relief to people, but more on that in a minute. First, I want to touch on an unanticipated side effect of the pandemic. We began to notice some supermarkets were having supply shortages. This is also when the great toilet paper shortage of 2020 began. I mean, you all heard that, you all know it, possibly you participated in that. The shortages were largely due to people's uncertainty about the future, led to hoarding of some staple goods. However, this is where we also learned an interesting fact. Food production plants package a lot of food in bulk for restaurants and couldn't quickly pivot to packaging for the increase of household demand at grocery stores. The smaller packaging material simply was not available. However, the most pressing issue that we discovered was food production plants that we were seeing. We saw clusters of COVID cases there. This raised the question of how do we feed people if food production is compromised? We couldn't, so we need to find solutions to help with that issue. In those food production plants, folks often work in close quarters with low wages and little to no health insurance. Similar to other workers in the agricultural industry, many food production workers also come from diverse backgrounds with a high population of Spanish-speaking workers. Adding to the issue, farmers also rely on these facilities to sell their produce, and North Carolina is one of the biggest pork producers in the world, so these implications go well beyond our borders. To help resolve these and other food-related problems, we established a food supply chain working group whose task was providing recommendations on keeping North Carolinians fed. I basically tasked a brigadier general, his name is Alan Boyette from the National Guard, and I also got members of Department of Agriculture, NC State, the DHHS, DPI, and many others. And so within a short time, we basically provided guidance to food plant operators on how they could make their plants safer for employees. And we utilized strike teams from the state, and we began to do testing sites at the food plants and providing them with PPE, also providing them with outreach material in both English and Spanish. And so I'm happy to say today we see fewer issues at our food processing plants since the implementation of these measures. You all know that schools closed across the state, and we recognize that many children rely on school nutrition programs, and they were going to need assistance. So the governor requested waivers to allow people to buy hot prepared meals with their North Carolina Food and Nutrition Services benefits at authorized supermarkets. The state also ensured these benefits are available to families with at least one eligible school-age child who depend on meals at school so they can still have access to food during school closures. The waivers allow flexibility to allow the Disaster Supplemental Nutrition Assistance Program, known as DSNAP, for all 100 counties, and added flexibility to the program to adhere to COVID guidelines to prevent exposure. So made a lot of progress there. We also made it so folks could go to schools and pick up meals. And also we used the National Guard to deliver meals. I want to take a moment and give a shout to the Guard because they've helped us greatly. They've basically done everything from delivering food, working at food banks, doing testing. Right now, they're helping us with vaccination strike teams. And so they've helped us out greatly. There's a lot of aspects to the pandemic response to discuss.
Yeah, can you not read?
I also want to take a moment to address our homeless population. We've recognized in a typical congregate shelter, there's a lot of folks there and they're sleeping many people in one room. Wasn't going to be a healthy situation during a pandemic. So we used federal money and our human resources branch and our business EOC to contract hotels around the state to put homeless folks into what we call non-congregate sheltering. This keeps them in a room by themselves so that they do not spread the COVID. We also know that there's a lot of issues with our low and moderate income residents.
What now?
So we established what we call the HOPE program, Housing Opportunities and Prevention of Evictions. To this date, we've put out over $135 million in awards for rent and utility payments to prevent folks from being evicted. Finally, I want to talk about vaccine distribution. You know, North Carolina is the 9th most populous state. We have over 10 million people with diverse backgrounds. As you can imagine, delivering vaccine to all these people can be challenging. However, of course, we began a plan to deliver vaccine before any vaccines were approved. We knew the supplies would be limited and distribution would need to be done in phases. So we used guidance from the CDC, and much like PPE distribution, we targeted healthcare workers first fighting COVID, and then long-term care staff and residents in the first phase. Y'all have all heard about the phases, and we're working through those right now. From there, we pivoted to 75 years and older, and we're moving to frontline essential workers. Now we've moved to folks that are over the age of 65, and that's how come I'm getting my shot today, because I'm over 65. We've vaccinated close to 2 million people already, and are steadily making progress. So no matter where you are, our expectation is that vaccine providers will ensure that vaccine is distributed and administered equitably so all North Carolinians have a spot to get their shot. We have a special group at DHHS that their specific focus is on building trust with historically marginalized populations. Longstanding and continuing racial and ethnic injustices in our healthcare systems contribute to a lack of trust in getting vaccines. So the department's working with trusted leaders and organizations to provide accurate information about the vaccines to all North Carolinians. So as you can see throughout the pandemic, our efforts have had a focus on providing access to equitable services to everybody in North Carolina, whether it's been testing, feeding, financial assistance, housing, or other areas. We've worked to address those needs. So if I can leave you with one final thought, you know, in emergency management and the Office of Recovery and Resiliency, and the state emergency response team in general, we work to ensure that everything that we do encompasses everybody, regardless of where they're from, race, religion, economic status, whatever. No matter what you do, and I'm talking to you, whatever you do in your life, whether you're in public service or private industry, I challenge you to provide equitable solutions and ideas that lift up everybody and improve society as a whole. By making North Carolina a great place to live, everybody should have a good place to live with good education, access to food, and things like that. I mean, those are things that everybody deserves to have. And with that, I think I'm on time, Madam President. And so I'm available for questions, but I do have to pop out pretty quick. I'm headed to go get my shot.
We would not stand in the way of you and your shot, Mike, but I can't thank you enough for that wonderful, essentially a survey of all that we've gone through since last March and within the time that we had available. So that was amazing. And especially all the various things as you and I had discussed, helping our students and others think about the ethical questions that come up in every decision that is made. And so thank you for highlighting all of that for us today. We are getting ready now to move into our breakout rooms. You will be taken into those rooms, and I want to assure you that you will get there. These have been pre-assigned, and sometimes that works and you'll go smoothly, and sometimes our great wizards of technology, Rebecca Leggett and Vicki Humphreys, will have to assign you manually. So if you don't go right at first, you'll know that you'll be coming right after that. As we get ready to go into those, I certainly want to give a shout out to Ken Wernick, who is the author of our cases this year again, and want to thank him for his generous support of the event. We normally have a small, but a stipend for our author of cases. And this year, Ken donated his back to the Ethics Bowl, and we deeply appreciate that. We especially appreciate his authoring of the cases at a time during the summer when the pandemic was still really just getting started. I will say that when we set ethics in a pandemic as our topic for the Ethics Bowl, we actually thought we would be talking about what had happened, right? Because remember, this was early on in that process last spring, and we had no idea we would still be at this level of the pandemic today. So these couldn't be more timely. I'm going to stop there and we'll ask our folks to take us away to our breakout rooms.